On behalf of the Presidential Steering Committee, the Federal Ministry of Health, the National Primary Healthcare Development Agency, and of course, the robust partnership between the National Primary Healthcare Development Agency and NAFDAC, I welcome you to this event. We have promised you in the last couple of days that we have successfully withdrawn about 1,066,214 doses of expired Astrazeneca vaccines. As you can see, these vaccines have now been deposited by the Abuja Environmental Protection Agency. We have come through in our promise to all Nigerians to be transparent in our delivery of vaccines. These vaccines did not expire before we took the decision to withdraw them. Today is an opportunity for Nigerians to have further faith in our vaccination program, because we have lived up to the expectation of all Nigerians. We had the option, if we were to take the advice of some experts, to try and use these vaccines even beyond the labeled expiry date. But working together with my sister, the DG of NAFDAC, we took that decision to destroy these vaccines at the point that they got expired. This is to further demonstrate the high standards that we operate within Nigeria. The work that we do is a work that requires trust. It is a sacred trust that has been bestowed on us by the generality of Nigerians. We hold that trust to be true, and we guard that trust very jealously. This is why today we are destroying these vaccines that have expired. I want to assure every Nigerian that the heroes of today's activity are actually the frontline health workers. A few months ago, when these vaccines were offered to us, we knew that they had a short shelf life. But we were living in an environment where the supply of COVID-19 vaccines were very scarce. They were not available due to vaccine nationalism. We had developed countries that procured these vaccines and hoarded them in their stores. At the point that they were about to expire, they were offered for donation. While we appreciate the donation from these countries, we have to acknowledge the fact that they were almost expired vaccines. Because we wanted to satisfy and protect Nigerians, we offered to accept these vaccines, worked collaboratively with NAFDAC to ensure that NAFDAC also tested and made sure that these vaccines were in good condition. And then we rolled out. We rolled out under very difficult circumstances. We actually got our frontline health workers working night and day. Staff of the National Primary Healthcare Development Agency did not know Saturdays or Sundays. We were working round the clock under very extreme situations just to make sure that Nigerians have access to vaccines even when these vaccines were not widely available. We were able to vaccinate over 10 million Nigerians with these short shelf life vaccines. If we were to wait until much later when vaccines will be widely available, maybe we will not have gotten any Nigerian vaccinated by now. So my heart and my pride goes out to those frontline health workers that continue to work around the clock. We still have short shelf life vaccines in the country. They are still potent. They have not reached their end of use date. And the health workers are still going there, working settlement to settlement, rural area by rural area, making sure that these vaccines are being administered. We have saved Nigeria over $40 million US. Resources that can be plowed into other areas of the health sector. So we're very proud today of all the health workers, not only because of the work that they've done around vaccination, but since the onset of the pandemic, the heroes of this pandemic have been the frontline health workers, and we will continue to encourage them, we'll continue to work with them until we're able to vaccinate at least 70% of our eligible population and achieve herd immunity. We guarantee Nigerians that these vaccines that we use are safe, they are effective, they can protect Nigerians against severe form of COVID-19 and also protect against death from COVID-19.